the Echo Lab here at Westmoreland Hospital. Just want to give you a little tour of our Echo Lab. So you come in and this is our Echo room. We have where we do our paperwork. This is one of our Echo machines and an Echo bed where the patient will lay down to have the echocardiogram. And we also do stress echoes in here, so there's a treadmill and the patient will walk on the treadmill, and then we'll get pictures before and after the stress echo to see how their heart functions before and after the test. So this patient came in for dyspnea on exertion, which is basically shortness of breath. So this is a picture of the left ventricle, the mitral valve, aortic valve. So we look at each one of the heart valves and look at the blood flow through the heart. So I'll zoom in, do some measurements. This is the color Doppler. The color Doppler shows what direction the blood's flowing through the heart. Look at different angles of the heart because this is two-dimensional. So this is the left ventricle in a different view, looking straight down through the ventricle to see all the walls squeezing in at one time. If you look at my arrow, you can see them squeezing to the arrow, and that's what you want. So we look at the function of the ventricles. We do some measurements. This is all four chambers of the left ventricle, left atrium, right ventricle. This is a mitral valve here and the tricuspid valve over here. So put some color on there. And look at the blood flow through the mitral valve. This is the aortic valve. The aortic valve pumps the blood out through to the brain first, then to the organs, and then to the lower extremities, and circulates back to the lungs to get oxygen. And then lastly, we look from the stomach, we angle up at the heart to make sure there's no fluid around the heart. And then we look where the IVC comes in to the right atrium, and that's what brings the blood back to the heart, and then it will take it to the lungs to get the oxygen for the rest of the body. Hi, just wanted to go over some reasons we do echoes. For chest pain, shortness of breath, if you have an abnormal EKG, palpitations, some people have valvular problems or congestive heart failure. There's different types of cardiomyopathies. We can have a myocardial infarct, which is a heart attack, coronary artery disease, aortic aneurysms, TIAs, strokes. That's for the echo. We do stress echoes for chest pain, shortness of breath, again, abnormal EKGs, palpitations. We also do TEEs, which we go with a probe down the throat to look at the heart from behind. And we do those for AFib, which is an abnormal rhythm of the heart, to rule out sources of emboli, which is like an infection that can affect the heart. Valves that are leaking pretty bad if they need to fix them, or any type of myoma, which is a type of tumor. We also use an image enhancer if we have a patient that has difficult images or we want to look for a clot in the heart. We inject in through an IV lipid base, and it's called Definity. And this is one of our patients here that needed it, so we put that in the IV, and then it attaches to the blood cells, and then it circulates through the heart, and we can see the wall motion a lot better and more clearly. We also do 3D imaging, but mostly on our TEs for the surgeons for valve replacements, to look at where the location is of the problem of the valve. So that's pretty much what we do in the echo lab.